So we'll move on. We'll have Anupam and we'll have Dr. Baliga after that.
Good afternoon, ladies and gentlemen. I have been associated with HIV/AIDS for the past 2 decades, and it's very important for us to bring an awareness program. I have been launched 2 care homes here, one's with the NAS Foundation and the other Shreya Holistic Care Center. And I feel today it's very important for us, we people, to come out of our glass houses, make these people, these patients of ours, aware of every fundamental right that is in the book. They don't know what rights they have, the right to medicine, the right to be hospitalized, the right to be counseled, and more ever, the right to be wanted. Why do we discriminate these people? For what? Because they've got the deadly virus? No. It's not a virus. It is we who have created this deadly virus within them by discriminating them. Every tear of a positive person when he's admitted in the hospital, universal precaution, big in red letters. The nurse doesn't want to come to him. The doctor abandons him. No treatment is given. Why? Why do we do this? Don't we have hearts? What rights are we talking about? The right for food, the right to love each other, the right to share with each other. But isn't this a sharing? Giving your hand, giving them hope, and giving them a life. I am running a HIV/AIDS center in Gurgaon called the Drone Foundation, where I'm taking care of 21 orphan children. You tell me, my dear friends, what's the fault of these kids who have been born positive? Both parents dead. I fight for their right to education. I fight for their right to be fed. I fight for the right to give them the best in life. Do any one of you out here open your heart, open your doors to these people? I only see one hand up. We as citizens of this country, our fundamental right is to give. Give and willingly give, but to the right people. You tap on the government's door, red tapeism. No, we don't have the funds. Global fund is diminished. Where? NACO, oh, we don't have the money for second line treatment. Patient who's been put on to first line treatment. Second line treatment, no, so the guy dies. No, you can't do something like that. He has every right to live. As you live, he has the right to live. The child has the right to live.
Actually, what I would like to talk to you about is the Anganwadi worker is posted there, but she comes from the cities once a week or she doesn't stay there. What we are trying to tell the government is, why don't we place people from those areas? Why do you have to post someone who will never go there? Why don't we start BRM, where we can make doctors out of people in those areas and place them in their own areas so that they don't come to the cities and so that they can help the rural people. If doctors doing MBBS are not going to the rural areas, then the government has to take an initiative. You know, one more thing I would like to tell you, I visited Nepal, and in Nepal we have these assistant health workers or AHWs who are dispensing medicines in the field because there is lack of doctors. Here, what happens is we call people quacks and just wash everything off our hands and we say, forget it, these are Bengali doctors and these are, why don't you legitimize bachelors of rural medicine teach a few good people the basics of common ailments and teach them which are the danger signs and refer those cases which are necessary. Now you have telemedicine, you have got many things where you can consult doctors in Apollo or doctors in America. But what I mean to say is, don't leave the people to die.
Okay, thank you, Dr. Baliga. Yes, ma'am.
I guess, and it was touched on just now, the one that has always shocked me because it just seems so futile and unnecessary is malaria. And, you know, I guess the first thing is, if malaria was suffered in Europe or America, it would have been solved years ago.
Yes.
You know, the solutions would have all been out there. But nevertheless, at times it also strikes me that this is one of those areas that actually highlights another issue, and that is that sometimes I get a perception that, whether it's out of pride or what, I'm not sure, but that the Indian system sometimes turns its back on potential help which is available from the rest of the world. In the US, in Africa, my understanding is that big steps forward have been made in malaria through the systems and programs about getting nets.
Yes, you're right. Yeah.
And yet, I don't see that happening here. We're still talking about a couple of institutes around the country who are going to come up with a cure if you just give them time and leave them to get on with their work. While we're waiting for them to come up with their work, children are dying in their millions. And why are we turning our back on potential help that's there internationally?
Yes. I think Praveen wants to address this. Praveen? Yeah. One minute, Praveen.
A very valid point actually. I mean, my immediate response to this, I mean, we are talking about a government which actually, allocates less than 1% of its GDP to health. And there is a whole drive towards privatization. And, when only the affluent people can actually have access to health services in this country. So in this scenario, where is the scope for R&D and where is the scope for, bringing in those kind of medications and so on? And the earlier question which somebody had raised, talked about the primary healthcare centers. These primary healthcare centers, some of volunteers, community volunteers who have done kind of a social audit, we have found largely that wherever the medical, the block medical officers are there and who are very active, only those actually tend to function.
Those are functioning.
But having said that, even in those, the infrastructure is very filthy. You and I will not go there, and you expect a poor person to go to those places. It's criminal. I mean, the health scenario in this country is criminal basically, and it has to be changed drastically, and somebody has to do something about it. And coming back to the question of Anganwadi workers, the whole concept started by enrolling volunteers from those communities as Anganwadi teachers. If you remember, that whole thing is died out. And today, who are these Anganwadi teachers? As doctor said, they come from the city, they come from the nearby big towns. They go once in a blue moon and so on. So the whole system is crushed actually, and there needs to be a real kind of a revolution or a kind of a movement to get these things on right. I always tell people, my friends and my folks with whom I work, in India there's a lot of schemes. If you just implement 50% of it properly,
good schemes.
It is going to change lives of millions of people.
Thank you, Praveen. And with that, yes.
I just wanted to, I worked for an NGO called CCF, Christian Children's Fund. And as a part of that, I had traveled to almost 120 villages in India, all over India, to the real remote villages. But one thing that I found in most of the, we used to go to the schools, that especially in North India, not so much in Kerala where I come from, and certain parts of South India also, that in these remote rural schools, 90% of the students were boys, and there were hardly 10% who were girls. I feel the ultimate problem in India, it's my personal opinion, is that the girl child is not being given the focus, the education, and the importance she rightly deserves. I also personally feel if you educate a boy, you educate an individual. If you educate the girl child, you educate a family, a society. She's the mother and she passes it on. And I feel societies can be saved and these 8 goals can be achieved basically by educating the girl child and giving her the importance she so rightly deserves. Opinion, please.
Thank you, Shubha. Good thought. And we had Safina with us yesterday. Safina, who runs the Foundation for Education of Girls Globally in India. And she's actually got all the girls in Pali in school. And she's now planning to replicate that model across India. We'll move on with the... yes, ma'am.
Just wanted to share my thoughts. We're talking about all the Millennium Development Goals and whose mandate. I think, and like everybody rightly said, it is every one of our mandate.
Right.
And for the last 22 years, we've been working with the tribals in the Nilgiris.
Right.
And we've brought down the infant mortality rates from 250 per thousand to 22 per thousand. Maternal mortality is 0.
Wow.
It can be done. And this is such a remote pocket with no education, no access, no money, no nothing. But it's just by making the people participate. And if each of us could take up one community and do this, our goals would be met.
Now that's an idea for action. Great.